born, raised, and lived in Ohio almost my whole life. I was born with a disability that affects my breathing, my heart rates, my immune system, and neurological systems. I was able to live what people would call a normal life, never letting disability define or dictate what I would do with my life. I was able to go to college and obtain a college degree. I worked, I paid taxes, and even contributed to society. In 2010, I had to become reliant on Ohio Medicaid and Medicare for my health care needs. I was not able to work anymore, and when my health eventually worsened, I had to apply for a home and community-based waiver to live in my community independently. In the beginning of getting waiver services, I was able to get things like home nursing, aid care, transportation, access to durable medical equipment, and just a handful of other services to help me live independently in my community. When the state privatized Medicaid in 2014, they used deceptive language that suggested that people were required to opt their Medicare into the 5 My Care Ohio managed care plans, and this created a lot of confusion. And there's actually a federal law that says that you have the right to keep your original Medicare. You don't have to opt into these combined plans. And so with the confusion and chaos brought other challenges for people. And people didn't know if they could get home nursing under their Medicare benefits or their Medicaid benefits. It caused a lot of chaos and confusion, and also created an attack on people's right to live independently in their community. Also, Ohio then, with these 5 managed care plans, found themselves on 6 different networks, 6 different insurance networks that basically led to problems with people not being able to find doctors, people having to give up doctors that they had for a long time that knew their care, home care providers not being credentialed. Some home care providers even ended up having to go 4 to 5 months in the beginning without pay, and some quit. I personally was affected by this. I had a provider that ended up homeless because of the privatization. She wasn't paid for 4.5 months. It caused me to actually have to enter a nursing home, and my care was jeopardized because of the pay problems in 2014 and in 2017. But there's been systematic problems, and this My Care Ohio program that they came up with in 2014 essentially was praised for the idea of one central contact for people on Medicare and Medicaid. It was praised for case management and coordination of services, but it has been an absolute disaster from the beginning. It has caused me to lose providers. It takes 3 to 6 months to credential established Medicaid providers under each of the managed care plans. And this is hard because if you don't get workers credentialed, you can't have workers in your home. It also makes it hard to get access to services for people. It's affected my independence. I have somebody that I've been trying to get credentialed since October 2019, and it's the middle of February of 2020. So this is an example, I can't meet all the hours that I'm authorized for, and these companies bank on the savings of saving money. They don't care that they have all this care authorized, but they don't have providers to provide the care. And if I don't have the providers I need to live in I can't live in my community independently, and it puts me at risk to be institutionalized, and it violates my Olmstead rights. But it isn't just home care. That is only one piece of this privatization that has caused challenges. There's also challenges for people with rare diseases finding doctors. There's a lot of network inadequacies, and a lot of the managed care companies have inaccurate, outdated provider directories. So when you think you found a doctor and you go there, they don't take that current plan. It's extremely frustrating. It wastes resources. But also access to mental health care and vision services and services for people that are hearing impaired is important, and these services aren't available because there's not enough network adequacy. And like for mental health care, we, like the state is supposed to be paying mental health providers, but people when they're in crisis, they don't have time to see if their insurance, their Medicaid meets the requirement for each provider. So it's creating lots of problems for people to get mental health care and substance abuse treatment and access to vision services and dental services. When you have a dental emergency, you want to try to get into the dentist, but you might have to call 20 different dentists just to find somebody that takes one of these private plans that you're forced to be under. And it's just absolutely ridiculous. It creates a lot of unnecessary stress on the consumer and families. And so the privatization has hurt many people. It's also cost a lot of people more money out of pocket. I've had a lot of challenges having to pay over 50% of my income for medical expenses. And before, when it was just Medicare and Medicaid, 100%, almost 100% of my expenses were paid for. But since the privatization, I've had to pay more money out, and it's caused more stress. And not just that, but this privatization of Medicaid is, I believe, like the state has to do something about it, because if we don't do something about it and we continue to work off of 6 different Medicaid systems, more people with disabilities especially are going to end up in institutions. Many people I know have moved into intermediate care facilities and nursing homes, having to leave the community because they can't find providers or doctors to treat their conditions, or they're just the care they need. And it's heartbreaking, because we're supposed to be moving forward in the disability rights movement, and with managed care we're moving backwards. It takes many months to get things you need. Like I needed SCDs, it's a compression device for a condition I have, and it took me 15 months. I had to reach out to the CEO. I had to send hundreds of emails, and it wasn't until I actually embarrassed my managed care plan on social media that they actually did anything to help me. This is just one example of something that happened to me, but there are lots of people who are going through. There was a guy who wanted to access the Cleveland Clinic, and he lived in Toledo, Ohio, and he was on the transplant list, and he could not use Cleveland Clinic because his managed care plan was not credentialed with the Cleveland Clinic, so he lost his place on the transplant list, and has had several complications with his health since then. And so that's just another heartbreaking story. I mean, it's just that the managed care companies are not credentialed with all the major hospitals. And so like with regular Medicaid, you can go anywhere within the state to get care, but if you're on a managed care plan, you're limited to very few hospitals and networks. And people don't realize that how this affects them. I mean, if you're camping in Conneaut and you get hurt, if the hospital there doesn't take your managed care plan, then you're pretty much sitting with a bill you have to pay. And it shouldn't be like this. It shouldn't be like this at all. And so, I've been trying to advocate that all the managed care plans be contracted with all the major hospitals, but also that we just go back to what we had before, because it was a lot better. These private companies get capitation payments every month for our care, and they get paid even if a person doesn't use their health insurance. And so, but for the people that want to use their health insurance, they should be able to access the services and access Medicaid. And so, they're getting paid for our care, but it's a shame when we can't access that care. And so, we have to let people know what the privatization is about, because if you have Medicaid, you should be able to use it. You shouldn't have to pay extra hundreds of dollars for things that are covered by Medicaid, but the managed care plans won't pay for. That's the reality of healthcare in Ohio, and I want more people to have these conversations about privatized healthcare.